Hey guys, it's Dr. Heary. In this video, we're talking thyroid. Thyroid disease, in my opinion, is one of the most poorly managed conditions in all of healthcare. It's very poorly managed. Why? Well, you go in with the classic symptoms. You can't lose weight, so there's weight loss resistance. You're constipated. Your hair's falling out in chunks. You're cold all the time. You feel fatigued. You have low energy levels. You got brittle nails. There's anxiety. There's depression. You wake up tired. You can't sleep. So you're checking all the boxes, and what do they do for you? Chemicals, synthetic stuff. Take this, come back in 6 weeks. Friends, here's what you need to understand about the thyroid. If you take anything away from this video right now, understand this key concept that 9 times out of 10, 90% of the time, thyroid dysfunction is autoimmune. It's called Hashimotos. It's your immune system that's the problem. It's not the thyroid. The problem is that your immune system, it's your immune system that's attacking the thyroid. So, if you're on, the synthetic stuff, if you're taking Synthroid, levothyroxine, any kind of, chemical cover-ups, you'll get about a 10% chance of success. You get about a 90% chance of failure. So we have to look at the immune system most of the time. Now, who am I and, why should you listen? So, my name is Dr. John Heary, and I've been in practice for about 24 years now and have helped thousands of patients get well from a functional standpoint, not guesswork. Not any more of these, chemical cover-ups. But we need to dig. We need to find out. We need to work towards solving the puzzle. Let's fix the problem. If I have a problem with my car and the check engine light comes on, do I just slap a piece of tape over it, or do I pay a mechanic to look underneath the hood and fix the problem? That's what we need. And so many doctors, this is such a failed condition in that it's so fixable, and it's so frustrating to me. But you have to understand the root cause of this thing. So we have to address the gut. We have to address the immune system. We have to take stress off of the immune system. We have to fix things at the cellular level, and that's why we do what we do, and why it's so unique and why it's so different, and probably unlike anything you've ever seen or tried before. It's because we have to fix the cell. All right. So your cells, they make up your tissues. Your tissues make up your organs. So if your cells are inflamed, if they're broken, if the receptors are blunted, we can't get the T3 into the cell. T3 is your active thyroid hormone. So, we can't get that into the cell. You're not going to work. You're going to have the classic thyroid symptoms. So we have to fix the cell, which in turn affects the tissues and the organs. And that's the approach that we take. And it works very, very well. So, if you're struggling with thyroid dysfunction, what I want to do is offer you a one-on-one discovery call. This is not a pushy sales call. This is not a high pressure call. No, this is simply just a chance, to ask each other questions and determine if what we have would make sense for you. This is not for everybody, but we do have to ask each other questions. So I'll be giving you a call at the time that you choose. So your next step, you want to click the button around this video, fill out your information, and then we'll grab a time slot, that's going to fit with your schedule. And I'll call you then, and then again, we'll hop on a quick call and determine if what we have makes sense for you. I'm going to leave with this. I use the analogy: if I'm going from California to New York and I don't have a map, how successful do you think I'd be? I'd be all over the place, right? I'd get lost, I'd be frustrated, I'd get, be confused. But if I had a clear blueprint, clear roadmap, a path, that's what we have to do with the thyroid. So, we've helped thousands of patients over the past 2 decades get this thing solved, once and for all, without more medications, without, chemical cover-ups. That's a failed model. I can't tell you how many patients have come to me. They dump a duffel bag, full of pills on my desk, and they're taking the synthetic stuff, and they still have the symptoms. The root cause was never addressed. We can do better. So your next step is to click the button, fill out your information, and we'll talk real soon. All right, take care.